Millions of Americans suffer from scoliosis as well as other neuromuscular disorders. Could there be a way to treat some of these debilitating conditions without a brace or without surgery? A New York yoga instructor claims that she achieved these results in just a matter of months. And when you look at these pictures, you're thinking, wait, what? How? She claims she did it with specialized yoga. Is it even possible? Join us now to discuss is orthopedic spine surgeon, Dr. Hooman Melamed.
Welcome.
Thank you. Thank you. Thank you. Your thoughts on yoga, and not just regular run-of-the-mill yoga, but this unique type of yoga to help people with scoliosis and these other back conditions. What are your thoughts?
I think what you just said, specific yoga, that's like the critical term. It's not just like, oh, I have scoliosis, I'm just going to go yoga. You have to pick a very, very specific person who understands what is going on with your posture and the scoliosis that can actually work with that. So I think yoga, Pilates, somebody like that, and then just daily like plyometrics exercise absolutely can start improving your posture.
So you're talking about a yoga instructor who is almost half yoga instructor, half physical therapist, in the sense that they know the kind of movements to maybe undo some of the damage without causing further damage. Because the crazy thing about yoga, and I've found this in my experience, is if you do it the wrong way, you can hurt yourself worse.
Absolutely, that's
right?
a critical thing, yes.
Not all cases of scoliosis are created equal, and not all cases of scoliosis will respond like those results to yoga alone.
Absolutely. I mean, you have to be under a provider, choose a provider who understands the scoliosis, work with them. So if your curvature is not progressing and you don't have pain and you're doing these modalities, you don't need surgery. But if your curve is progressing and you're getting pain, that's of course when you need surgery. But that's only a small percentage. Remember, what I'm saying is that you have to look at this when you're 20 years old. You got to get started early on these exercises.
The younger patients with those results, I sort of get it, but that older woman who's like...
Well, very important. I was surprised too, but you have to understand, when you get older, you get more stiff, you have more osteoporosis, so as you get more stiff, you become more painful. So your joints become less lubricant. So if you have with somebody who is working, who can slowly work and start basically lubricating your joints.
Kind of getting the rust out.
Exactly, you're getting it more fluidity and mobility is when you can basically, because it's painful all of a sudden to stand up straight, but it's slowly get on that you can achieve that.
Here's been my experience. I had a functional problem and a mechanical problem, and I looked in the mirror, and this is what when I bent over, this is what it looked like. This is how offset I was. And then after a couple of years of all these moves, now it's all been balanced out. And I never thought that was gonna be possible. But if you stick to it with the right person, I personally believe you can do this. So I'm a big fan.
How can you tell if you have really found the right person? Because anybody can kind of say, oh, I'll take your money. And they say, I'm a yoga instructor. Are there certain questions you can ask, kind of certain red flags or anything?
I think that's a very good point, and that's very tough. It's like, how do you know somebody's a good dentist or a good chiropractor? I think it's a lot of word of mouth, reviews online, read about things, and trying it with them. If you, after 1 or 2 sessions, if you're not seeing results, that's obviously not a good thing.
The problem with a yoga class is if you're not getting one-on-one directions, you're going to potentially hurt yourself. You have to go see a therapist who can guide you with the kind of movements that are going to be safe for you.
That's right, if you have one-on-one, because I can tell you, all 4 of us sitting here right now, we can't do the same yoga poses together. We need somebody showing us basically, because our body habits is different.
I love how open-minded you are about all this stuff.
Thank you, yes.
Thank you so much.